Can carpal tunnel surgery cause radiating arm pain? In a nutshell, carpal tunnel surgery isn't going to cause radiating arm pain, but it certainly can unmask radiating arm pain. One of the biggest reasons why carpal tunnel surgery might fail for somebody is if it's done for the wrong diagnosis or if it's done for a not complete diagnosis. And the most common reason for that is something called double crush syndrome, where somebody will have two problems along the same nerve chain. So, for example, they'll have a pinched nerve in their neck and they'll also have carpal tunnel syndrome. So, if they have, for example, a C7 pinched nerve, the C7 nerve root goes down into the arm, it branches off, it becomes the median nerve, which can then also be affected by carpal tunnel syndrome. Sometimes the biggest presenting symptom of that will look just like carpal tunnel syndrome. And so the diagnosis gets made of carpal tunnel syndrome. Maybe they go through some conservative treatment. The symptoms aren't getting better. The assumption is that the carpal tunnel syndrome is just a difficult or severe case. And so they end up getting surgery for the carpal tunnel syndrome. A lot of times that will fix some of the problem, but not all of the problem. And some of the time it'll fix maybe one of the problems, but it'll unmask another part of the problem. So if that person also had a pinched nerve in their C7, but nobody thought to look for it, or they missed it, or they just never thought of it, and now the carpal tunnel syndrome is better, they might become much more aware of the radiating arm pain, which was probably there all along, but they weren't as aware of it as before because the symptoms that they were getting in their wrists and their hand were just overwhelming the brain in that instance. There's a Chinese proverb that says, if you want to get rid of back pain, you get a toothache. And the point of that is that pain tends to stand in line, right? If you have terrible radiating arm pain and you want to forget about it, you could take a hammer, hit your toe. For a little while anyway, you'll forget about the pain in your neck and your arm because you'll just be focused on your toe. Don't do that. But you get the point. And similarly, if you have really bad carpal tunnel syndrome symptoms, and that's what you're really focused on, and now you have surgery and that takes away a large part of that, you might then become more aware of the symptoms that were there all along in your neck and your arm, for example. Or sometimes because the carpal tunnel syndrome is resolved, you start doing things differently, having different activities of daily living, and that might inadvertently put more stress on the neck, which then brings out those C7 or cervical radiculopathy symptoms, those pinched nerve in your neck symptoms. So no, carpal tunnel surgery shouldn't directly cause, for example, a pinched nerve in your neck, but it certainly can unmask other problems that were being subsumed by the attention to the symptoms from the carpal tunnel syndrome,